The new year is just around the corner, but now is the time to closely examine your current situation and consider what you need from a health insurance plan to ensure that you have the right coverage moving forward. Here today to help us understand the options available during the annual individual enrollment period is Carle Timms, community broker and partner liaison for Health Alliance. Thank you so much for being here.
Thank you for having me.
And I do have to shout out Carle for sponsoring this segment, giving us the opportunity to share all this important information about the open enrollment period. Why is this period so important?
Oh, because this is the time of year when people can take a look at their plans and see what really works for them. So if you're an individual, not someone on a group plan with your employer, but if you're an individual, from November 1st until January 15th is your time to make your plan decisions.
Okay, and what if someone is intimidated by the cost between that time period of like, oh, the holidays are coming up. How do I plan for the holidays and Christmas and find the right plan? Is that something they should be intimidated by?
No, because everybody needs health insurance, and so it's something that should be part of your budget. And we have some very affordable plans, including the Affordable Care Act, where you can have help paying for your health insurance.
Okay, and where can a person find like a specialist to help them navigate the process?
Well, there are several ways. First of all, they can call us, and we'll be glad to help. And then we'll look at all of your options. They can also go to an independent broker. And that person can help them look at various different plans. There are people out there to help. And so if you call us on our toll-free number, which is 877-686-1168, we have specialists who will help you with that.
Oh, okay. And when you all provide help, what's that process like?
It's a conversation like we're having now.
Oh, okay.
So they'll ask you what kind of doctors you want to use, what medical services you need. They'll ask you about your budget, and they'll ask you about your medicines, and that's really important. And so once they know what you prefer and what you're planning to take for your medicines, they can find a plan that will be the most affordable for you.
Okay, so you all already have the questions in line to help the person select the right plan.
Exactly.
Okay, and then my next question is, who qualifies for an individual plan?
Anyone who's not on Medicare, who's not on an employer-paid program, who's on their own. And so that could be people who are not working, it could be people who are self-employed, anyone like that. But if you don't have access to a group plan or a Medicare plan, then it's your choice to pick your plan.
Yes. Okay, something that's happening right now is text messages from like random people. I'm sure it's not just me. They're like, hi, this is Vicky. And I'm like, do I know Vicky? But no, they're messaging me about picking a health plan.
Right.
How do you know which one how do you know if you're going with the right company?
Just like Medicare, individual health insurance is personal.
Okay.
So the things that I talked about, who do you want your doctors and hospital to be? What kind of medicines are you taking? What is your current health needs? You look at those and then you decide based on that, and then affordability. So Vicky may be wonderful, but since you don't know her, I'm not sure that you want to have that chat.
Okay. Yes, and for someone who may be watching and they may think, well, I can go a year without getting a plan, what would you say to encourage them to reconsider that thought?
Well, what I usually say if someone tells me they don't have insurance is I'm going to bubble wrap you for that year, because anything can happen. You may be young and active, and you could still be hit by a car.
Yes.
And so I really think health insurance is very important, and that's one of the reasons the government put the Affordable Care Act into place, is because they want everybody to be able to afford health insurance so that they can maintain a healthy lifestyle.
For sure. Well, Carle, we appreciate you so much. This is important information, although it can seem like a foreign language to some people. You really help us make sense of it. So we appreciate you for that and all the work Health Alliance is doing. Thank you to Carle for allowing you to come on this platform to share about it. We thank them for sponsoring our segment. And I would just say, don't wait until the last minute to enroll. We'll connect you at ciLiving.tv with all the information you need.